Alexis Hartmann was chair of the Department of Pediatrics for 28 years. His career marked the era of modern therapeutics in pediatrics. As a medical student, he worked in the laboratory of Philip Schaefer, who was chair of the Department of Biochemistry. And with Schaefer, he participated in the first isolation of insulin in the United States. And he was part of the team that administered insulin to the first child with diabetes in the United States. And that happened here in our medical center. And that inaugurated not only the history of the Washington University enormous commitment to understanding diabetes, but the initial commitment of Alexis Hartmann to understanding diabetes, metabolism, and fluid and electrolyte balance. It is my enormous pleasure today to host this inauguration of the Alexis Hartmann Professorship and award this to Tom Ferkol.
The awarding of an endowed professorship is the highest honor that we can bestow on a member of our faculty, and it reflects the ongoing confidence and the future expectations with regard to the performance of that individual. In this case, it also allows us to recognize one of the really great names in the history of Washington University and St. Louis Children's Hospital in Alexis Hartmann. Congratulations.
But thinking back as to how I got here is that I received a piece of advice when I was rather young. I think I was a fellow at the time, and they said that the most important word for an academic physician is no. That you need to say no. Once you see a patient, no. You're interested in doing this research project? No. Stay focused. And I would have to say, and this may not work for everybody, but I have to say that I've had more fun and more enjoyment after I've said yes. And I'll give you some examples why. When I first got here in 2000, I was still doing an awful lot of work trying to using animal models for understanding inflammation in the CF lung. And I remember giving a talk very early on to our colleagues in pulmonary and critical care medicine over at Barnes Jewish Hospital. And right after the session, Dan Schuster, who is truly missed, came down and says, "Tom, I think I can help you with your problem." And that led to a whole series of experiments, of work that is actually translated from the bench to patients and continues, where we're trying to use non-invasive imaging techniques to assess inflammation in the cystic fibrosis lung. If I would have said no, I would have missed a really exciting project that I think still has the potential of providing clinical value. Aaron Hamvis, came up to me a couple of years ago and said, "Tom, we need to put together a project in response to an RFA trying to understand better pulmonary measures of premature lung disease." And I said, I knew nothing about premature lung disease, other than the fact I get consulted every once in a while, but I said, yeah, we should do this. This is something that needs to be done. And this has now led to the PROP program, and I am absolutely convinced between Aaron and Jim Kemp and Fred Costi, we're going to make some very interesting discoveries here that's going to change the way we think about bronchopulmonary dysplasia. And then you have these two individuals up here who are my unofficial campaign managers for my election to the American Thoracic Society, McGee Lee and Stephanie Davis, who, with Mike Knowles, asked me to participate in this consortium trying to understand genetic abnormalities of mucociliary clearance, with primarily focusing on primary ciliary dyskinesia. I was doing CF then when we first started talking about this. It didn't seem like a reasonable thing to do at that time. It was going to distract me from what I was supposed to do. And quite frankly, it was the smartest thing I've ever done.